The next very important disease and the next very important disease and is oftenly present in our population, that is known as influenza, also known as common cold or the seasonal flu. What are causes of the influenza? RNA virus, the virus having a single-stranded RNA or double-stranded RNA, and different strains of the influenza virus. They have the ability to mutate into different forms. The infection is transmitted by inhaling a respiratory droplet or by coming in contact, such as the drinking from a contaminated glass or coming in contact to the contaminated air. Or, for example, if in a class some students, two or three students, have caused influenza, uh, they can spread this disease in the whole class. What are common symptoms of the influenza? Actually, if we talk about influenza, it's a respiratory disease. That is the disease of commonly of the upper airway tract. That is the nose, throat, and lungs infection that can be caused by influenza virus. Many people use the word flu when they actually have a flu or have a cold. Although the common cold is also caused by viruses, the flu and common cold differ in several ways. Common cold and flu, they are different. In North America, flu almost always strikes between October and April, and same is the case in Pakistan and in Asia. Commonly, flu attack occurs between October, September, and November. Most people who gets the flu will recover within 7 to 10 days without help of any medication. But some people are at risk of developing complications such as pneumonia. On average, about 3,500 people in in Asia die each year from complications of influenza, and about 12,000 people with flu they are hospitalized in Pakistan. Most of these people have other medical conditions, are seniors, or if they are very young children. What are causes of influenza? It is contagious, which means that it can be spread easily from person to person due to a close contact. Viruses that cause influenza spread from person to person mainly by droplets of respiratory fluids that are sent through the air. When someone infected with the virus cough or sneezes, other people inhale the airborne virus and can become infected. So the flu can also be spread when someone touches a surface, for example, the door knobs or the countertops or the telephones that has the virus on it, and then touches his or her nose, mouth or ears or eyes. The flu is most easily spread to that person, to the healthy person, and the healthy person can become infected. Similarly, if someone goes to the crowded places such as schools and offices, he or she is more likely to have the influenza. There are three types of influenza viruses: influenza virus A, B, and C. Influenza A and B, they are associated with seasonal influenza and most outbreaks of the flu, while influenza C is rare and does not usually cause outbreaks. Type A influenza poses the most serious problem for humans, and strains of this type A, they have also been found in birds, pigs, and other animals. So the viruses that affect two different species, sometimes it combine and mix and match genetic information to create a new strain that nobody is immune to the new strain, and for which no vaccine has been prepared. So this type of new strain can cause a outbreak or the epidemic, as is caused in recently in case of COVID-19. The flu takes 1 to 4 days to incubate in humans, but infected people become contagious before symptoms appear. So often, just the day after the virus enters the body, adults remain infectious. That is, they can spread the virus to other persons, healthy persons, for about 5 to 7 days, and the young children may remain infectious for a few days longer. What are symptoms and complications of the influenza? Initial flu symptoms include headache, chills, and a cough. Symptoms such as fever, loss of appetite, and mucus itches, they are soon to follow. Other symptoms such as nausea, vomiting, and diarrhea, they are rare in adults but are common symptoms in children. Since many people think that they have the flu when it's actually a bad cold, here is the quick. While if we talk about treatments, apparently there are not enough treatments available for the influenza, as influenza is a viral disease and we have no antiviruses present in our in our medicine history. But in order to mild the symptoms, the patient can be given anti-allergic drugs such as we can give cold rex or as some other anti-allergic drugs to children and to the patients in order to just mild the symptoms and the conditions. Or maybe or paracetamol may be given to reduce the fever. That's it. There is no such specific drugs for to cure influenza or the flu virus. Then comes tuberculosis. Tuberculosis, it's a bacterial infection spread through inhaling tiny droplets from the cough or sneezes of an infected person. It mainly affects the lungs, but it can affect any parts of the body, including the tummy, abdomen, glands, bones, and nervous system. TB or the tuberculosis is a potentially serious condition, but it can be cured if it's treated with the right antibiotics and is caught in time and is diagnosed in time. What causes fever, TB? TB is a bacterial infection. TB that affect the lungs, pulmonary TB that is the most contagious type, but it usually only spreads after prolonged exposure to someone with the illness. In most healthy people, the body's natural defense against infection and illness, that is, which is known as immune system, it kills the bacteria and there are no symptoms for a long time. Sometimes the immune system cannot kill the bacteria but manages to prevent it spreading in the body. You will not have any symptoms in this case, but the bacteria will remain in the body. And we can see here the TB bacteria present in the alveoli and causing infection. This is known as latent TB. People with latent TB are not infectious to others as they are not showing any symptoms and they are not contagious, but they have quite TB in their lungs that might be contagious in the coming future. If the immune system fails to kill or contain the infections, it can spread within the lungs or other parts of the body, and symptoms will develop within a few weeks or months and is known as now the condition is known as active TB and has become contagious and can affect other people's also. Latent TB could develop into an active TB disease at a later date, particularly if the immune system becomes weak. What are typical symptoms of TB? They include a persistent cough that lasts more than 3 weeks and usually brings up the mucus, which may be bloody. Weight loss includes in the symptoms of the TB. Night sweats, high temperature, tiredness and fatigue, loss of appetite, swellings in the neck. You should see a health provider or a doctor if you have a cough that lasts more than 3 weeks or 4 weeks, or if you have blood in your cough. So it means that TB is becoming active and contagious. How it is diagnosed and treated? With treatment, TB can almost always be cured. A course of antibiotics will usually need to be taken for 6 months or 9 months. Thanks to the medicine history, thanks to the researchers that very good antibiotics and are available against the TB. So TB is purely curable at any stage, even if it becomes acute and worsen. Several different antibiotics they are used because some forms of TB are resistant to certain antibiotics. If someone is infected with a drug resistant form of TB, treatment with 6 or more different medications may be needed. And if someone is diagnosed with pulmonary TB, he or she will be contagious for about 2 to 3 weeks into the course of treatment. And the patient will not usually need to be isolated during this time, but it's important to take some basic precautions to stop the infection spreading to the family members and friends. So the patient should take care that he or she stay away from work, school or college until the TB treatment team advise the patient that it's safe now to return to the crowded environment. It is always the patient should always cover the mouth when coughing, sneezing, or laughing, and must carefully dispose of any used tissue in a sealed plastic bag. Similarly, open windows when possible to ensure a good supply of fresh air in the area where the patient spends most of the time. And the patient must avoid sleeping in the same room as other people, other healthy people, in order to avoid the spreading of contamination. If the patient are in close contact with someone who has, if a healthy person is in close contact with someone who have TB, who is a TB patient, the healthy person should have tests to see whether he is infected or not. This can include a chest X-ray. So for the diagnosis, the some important tests they include chest X-ray, blood test, and a skin test, which is called Mantoux test. Whether vaccination for TB is available or not. The BCG vaccine that offers protection against TB. The first vaccine that is given to a newborn is a BCG vaccination and is recommended on the NHS for babies, children and adults under the age of 35 who are considered to be at risk of catching TB. The BCG vaccine is not routinely given to anyone over the age of 35 as there's no evidence that it works for the people in this age group. At risk groups include the groups which are mostly at risk. They are children living in areas with high rates of TB, and there are people with close family members from countries with high TB rates, and the people going to live and work with local people for more than 3 months in an area with high rates of TB. Similarly, if you have not been previously vaccinated, you do not have, for example, a BCG vaccine or relevant documentation for this, you might be at a greater risk of getting TB. Then comes bronchitis. What is a chronic bronchitis? The bronchi, when the bronchi are we know that the bronchi, the major organ of the respiratory system, they are the main airways in the lungs, which branch off on either side of the windpipe. Here are the bronchi. They lead to smaller and smaller airways inside the lungs, known as bronchioles. The walls of the bronchi produce mucus to trap dust and other particles that could otherwise cause irritation. Most cases of bronchitis they develop when an infection causes the bronchi to become irritated and inflamed. We can see here a normal bronchi and the bronchi with bronchitis, that is that has caused inflammation and mucus is present in it. Most cases of acute bronchitis they are developed because of an infection which causes them to produce more mucus than usual. So the body actually tries to shift this extra mucus through coughing and try to expel this extra mucus out of the body. Smoking is the most common cause of chronic bronchitis. Over time, tobacco smoke can cause permanent damage to the bronchi, causing them to become inflamed. Acute bronchitis comes on suddenly. It causes the tubes that carry air to the lungs to swell, inflamed, and carry mucus. It usually gets better on its own without the need of medication. The infection usually lasts for 3 to 10 days, but the cough can continue for several weeks. It is different from chronic bronchitis, a long-term disease. There is no cure for chronic bronchitis. It is difficult for chronic bronchitis, which is a long-term disease. There is no cure for chronic bronchitis. Actually, it's a sudden swelling in the major, if we talk about its summary, we can say that it's a sudden swelling in the major airways into the lungs called bronchi. It is usually caused by a virus, but it can also be caused by breathing in things that irritate the lungs, such as tobacco smoke, fumes, dust, and air pollution. Bacteria sometimes also cause acute bronchitis. How it affects the body? When someone have acute bronchitis, the cells that line the airways called bronchi, they becomes inflamed. The infection usually start in the nose or throat and travel to the lungs. When the body tries to fight the infection, it causes the tubes leading to the lungs to swell. This causes cough. Sometimes it's a dry cough, but often the cough might be mucus, might contain mucus. Because the airways are swollen in this disease, less air can move through the tubes to the lungs. This can cause wheezing, chest tightness, and shortness of breath. Eventually, the body fights the infection and heals. Acute bronchitis usually lasts for 3 to 10 days. However, the patient may have cough and produce mucus for several weeks after even after the healing of infection. How serious is the acute bronchitis? If the swelling lasts only a short time, it usually does not cause any long-term breathing problems. However, it is possible that for people with a weakened immune system or other major health problems to develop severe problems, such as it may lead to pneumonia or other respiratory failure. In general, the patient, those that develop major problems, they are older adults, young children, people with other major health conditions such as cancer or diabetes, people who have not received an immunization of the flu or pneumonia. What are symptoms of acute bronchitis? Acute bronchitis sometimes diagnosed also as pneumonia, but the chest X-ray can help doctors to make an accurate diagnosis. That is, it is different from pneumonia. The most common symptoms of acute bronchitis, they are very similar to pneumonia and are coughing up yellow or green mucus, running and stuffy nose, starting a few days before chest congestion, feeling run down or tired, sore ribs, from long periods of coughing, not being able to be as active, wheezing sound or a whistling sound when breathing. The patient should contact the doctor if he or she have any of these symptoms. So if we talk about the causes, we can say that acute bronchitis is usually caused by a virus. In rare cases, it is caused by bacteria, although this occurs in fewer than 10% of cases. Risk factors, if we talk about risk factors, the people which are in close contact with someone who has a cold or acute bronchitis, and the people who have not any age appropriate immunization shots, that is who do not taken any vaccination or medication for this, and the people who are exposed to tobacco smoke, fumes, dust, and air pollution. If we talk about the treatment, in most cases bronchitis will clear up by itself and within a few weeks without the need of any treatment. This type of bronchitis is known as acute bronchitis. While if you are waiting for it to pass, you should drink lots of fluid and get plenty of rest. In some cases, the symptoms of bronchitis can last much longer. If symptoms last for at least 3 months, it is known as chronic bronchitis. There is no cure for chronic bronchitis, but there are several medications that help relieve the symptoms. And it is also important to avoid smoking and smoky environment, because in smoky environment the symptoms may become worse. Then comes cystic fibrosis. What is a cystic fibrosis? It's an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. These secreted fluids, they are normally thin and slippery, but in people with cystic fibrosis, a defective gene causes the secretion to become sticky and thick. Instead of acting as lubricants, the secretions plug up tubes, ducts, and passageways, especially in the lungs and pancreas. Although cystic fibrosis is progressive and require daily care, people with this disease, they are usually able to attend school and work and can spend their routine life, but they often have a better quality of life than people which had these previous decades. Improvement in screening and treatment mean that people with this disease now may live into their mild conditions. What are its symptoms? They may vary. Symptoms and signs of cystic fibrosis may vary. For example, depending upon the severity of the disease, even in the same person, symptoms may worsen or improve as time passes. Some people may not experience symptoms until their teenage years or adulthood. People who are not diagnosed until adulthood usually have milder disease and are not showing any symptoms and are more likely to have atypical symptoms such as recurring bouts of an inflamed pancreas or pancreatitis, infertility, and recurring pneumonia. While its common signs and symptoms, they include persistent cough that produce thick mucus, wheezing sound, exercise intolerance, that is the patient are not able to do exercise and long and heavy exercise, especially repeated lung infections, inflamed nasal passages or a stuffy nose, and recurrent sinusitis. There are actually the thick the people with cystic fibrosis, they have a higher than normal level of salt in their sweats. The cystic fibrosis can show symptoms in respiratory system and also can show some symptoms in digestive system. So the digestive signs and symptoms include the thick mucus can also block tubes that carry digestive enzymes from the pancreas to the small intestine. So without these digestive enzymes, the intestine are not able to completely absorb the nutrients in the blood, in the food we eat. So the results are often in the symptoms like foul swelling, greasy stool, poor weight gain and growth, intestinal blockage, particularly newborns, and chronic and severe constipation, which may include frequent straining while trying to pass stool, eventually causing part of the rectum to protrude or block outside the anus. So if we talk about its main cause, a defect in a CFTR gene, that is a cystic fibrosis transfer gene, a gene that makes protein which controls the movement of water and salt in the cells. The sticky mucus blocks the airway in the lungs. Treatment may include antibiotics, oral antibiotics or inhaled antibiotics or intravenous and azithromycin. Treatment may include slight exercise, chest physical therapy, also called chest clapping perfusion. It might also include the cystic fibrosis can also cause liver diseases, diabetes, gallstone, pancreatitis, that is a painful inflammation of the pancreas. So our lecture related to disorders of the respiratory system